MediPort Catacolo is not just another medical point in a port. It is a new integrated health security model for cruise destinations. In a single point, we combine immediate medical assessment, advanced telemedicine, ambulance support, and organized interconnection with appropriate health units. Located at the gateway to ancient Olympia, MediPort can serve passengers, crew, port workers, visitors, and the local community. For a strategic investor, it is the starting point of a new scalable industry, destination health infrastructure. Our vision is clear: to create a solid healthcare infrastructure right where international tourism meets the local community. MediPort integrates 6 critical functions: immediate medical assessment, telemedicine, access to medical specialties, ambulance support, organized transportation, and social health services. What until now operated in a fragmented manner is transformed into a single, coordinated system. The investment value lies precisely in this integration: one infrastructure, multiple services, multiple user groups, and the ability to operate throughout the year. Catacolo is one of the most important Greek cruise destinations and the main sea access point to ancient Olympia. Every year, it welcomes a large number of ships, thousands of international visitors, multinational crews, and an increased percentage of older passengers. At the same time, excursions to Olympia are carried out with strict time limits. A medical incident can affect not only a passenger, but the operation of the excursion, the ship, and the entire destination. This makes Catacolo an ideal pilot site: high international visibility, real need, and immediate possibility of evaluating the model. When a passenger or crew member needs assistance on shore, today the process can be fragmented. There is a risk of delay in recognizing the severity, difficulty in contacting the appropriate doctor, unnecessary transport, uncertainty about the appropriate hospital, and loss of valuable operational time. The critical gap lies between the ship, the port, the ambulance, and the health system. MediPort comes to act as the central coordinator of this chain. It does not just add a service, it organizes the entire incident journey, reducing risk and operational uncertainty. MediPort is based on a simple but powerful principle: the patient should receive the right care at the right place and at the right time. The process begins with immediate reception and recording of vital signs. It continues with a telemedical examination by an appropriate doctor and ends with a documented clinical decision. If transportation is required, the ambulance is activated and a connection is made to the appropriate health unit. In this way, unnecessary travel is avoided, while serious cases are directed more quickly to where they really need to be. The operational advantage of MediPort is that it brings together in one place what is currently required by many different providers. The physical MedSpot offers immediate access. Telemedicine provides specialized medical opinion. The ambulance ensures an organized response. Hospital connectivity prepares for an appropriate reception. Social services expand the footprint in the local community. It is a combination of physical infrastructure, technology, and operational coordination. This creates an integrated model, which can be standardized, replicated, and transferred to other tourist destinations. The incident route is fully organized. The ship, crew, or the passenger himself informs MediPort. The incident is immediately received by specialized personnel. Vital signs are recorded, and a telemedical assessment is performed. Based on the clinical data, one of 4 clear decisions is made: treatment at MediPort, return to the ship with instructions, referral for further examination, or transport by ambulance. The value lies in the quality of the decision before transport: faster assessment, better clinical decision, and safer management. For a passenger in an unfamiliar destination, a health issue immediately creates uncertainty and fear. MediPort offers an easily identifiable point of medical support, quick access to assessment, communication with a doctor via telemedicine, and support in English. The passenger avoids unnecessary travel and receives clear instructions on whether they can safely return to the ship or if further care is required. For a cruise, A sense of safety is not an additional service. It is part of the overall travel experience and trust in the brand. Crews have different needs than passengers. They have limited time on shore and require rapid, practical, and evidence-based support. MediPort can provide immediate medical assessment, basic diagnostic testing, telemedicine with the appropriate specialty, and guidance for a safe return to work. When further care is required, referral or hospital transport is arranged with communication to the company's medical operations. For the cruise line, this means less handling time, better protection of personnel, and reduced operational disruption. For a cruise line, MediPort turns an unforeseen incident into a predefined and controlled process. The company knows in advance who is responding, what protocol is being followed, how the patient is being assessed, and how communication with the ship is being carried out. The collaboration enhances the duty of care, reduces operational uncertainty, and provides centralized reporting without disclosing personal data. At the same time, it enhances the passenger and crew experience and creates a measurable social and ESG footprint. MediPort does not operate as an occasional supplier. It operates as a strategic health partner of the destination. Health preparedness is a key element of the resilience of a modern tourist destination. MediPort enhances visitor safety, supports port operations, and improves the destination's ability to respond to real incidents. At the same time, it connects tourism activity with local health and strengthens the social acceptance of cruising. A safe destination is more competitive, more reliable, and more sustainable. For the investor, MediPort is an infrastructure that creates value on multiple levels: tourist, business, social, and institutional. The model is not limited to cruise ship arrival days. The partnership can fund free services for the elderly, people with disabilities, the chronically ill, bedridden residents, financially vulnerable families, and remote areas. Services can include preventative checkups, telemedicine assessments, e-nurse visits, vital signs monitoring, and transportation support. Thus, the cruise activity leaves a lasting positive imprint on the destination. Social value is not just a communication message. It is an integrated part of the business model. Every strategic partnership must be able to demonstrate the value it creates. For this reason, MediPort is accompanied by an annual social and operational impact report. Passengers and crew members supported, telemedicine sessions, response times, transfers, incidents treated without unnecessary transport, and free services to residents are recorded. At the same time, the availability of the service and user satisfaction are assessed. For the investor, this reduces uncertainty. The performance of the partnership is not described theoretically. It is documented with real data. The proposal does not concern a conventional promotional sponsorship. It concerns the creation of a specific, operational, and measurable health safety project in Catacolo and at the gateway to ancient Olympia. The strategic partner supports its own passengers and crews, but at the same time strengthens the safety of the destination, the local community, and sustainable tourism development. The partnership is linked to duty of care, destination resilience, responsible tourism, health innovation, and ESG strategy. In other words, a campaign is not being funded. A real infrastructure is being created. A significant advantage of MediPort is its financial flexibility. The partnership can take the form of annual operating funding, a paid pilot program, the purchase of specific health services, or the financing of medical and telemedicine equipment. It can also include a social program for the local community, an impact loan, or a combination of sponsorship, service provision, and impact financing. This allows each company or investor to choose the level of participation that corresponds to its strategy. The goal is a model that is transparent, measurable, and financially sustainable. The commercial strategy is specific and focused. The target is international groups that have frequent access to Catacolo, manage multiple cruise brands, implement responsible tourism policies, and seek social impact and destination development programs. The first group includes TUI and Marella Cruises, MSC Cruises and the MSC Foundation, Royal Caribbean Group, Norwegian Cruise Line Holdings, Carnival Corporation, Costa Cruises, and Celestial Cruises. This is a concentrated B2B market in which an agreement can cover more than one ship or brand and create expansion prospects in many ports. TUI is a particularly strategic case as it directly connects tourism, sustainability, and social innovation financing tools. The proposal can be structured through TUI Future Shapers as the first integrated health and telemedicine hub in a Greek cruise destination. The collaboration can include impact loans, infrastructure financing, Marella Cruises participation, passenger referrals, and a joint social health program. The greatest potential lies in the expansion of the model to other Greek destinations where TUI operates. Therefore, it is not a standalone project, but the beginning of a broader strategic destination health platform. MSC has a frequent and visible presence in Katakolo, with ships such as MSC Sinfonia, MSC Fantasia, and MSC Lyrica. At the same time, both the company and the MSC Foundation have a clear focus on health, community protection, sustainable development, and destination resilience. The partnership could include annual operational support, equipment funding, a co-branded med spot, and complementary services for passengers, crew, and residents. The essence of the proposal is to transform MSC's existing presence in Katakolo into a measurable health, social value, and destination resilience program. Royal Caribbean Group has different brands, such as Royal Caribbean International, Celebrity Cruises, and Silversea. This multi-level presence creates the possibility of an agreement with significant operational and communication value. MediPort can be presented as a health innovation pilot at the gateway to ancient Olympia, linked to the Port Partners programs and destination development actions. The proposal covers health security, passenger and crew support, a social program, and the possibility of piloting in other ports. For the group, it is a limited risk test. For MediPort, it is a potential entry into a global network of destinations. Norwegian Cruise Line Holdings offers a particularly attractive prospect because a group-wide partnership can serve 3 different brands: Norwegian Cruise Line, Oceania Cruises, and Regent Seven Seas Cruises. MediPort can provide shoreside urgent care, telemedicine before possible evacuation, immediate crew support, hospital connectivity, and premium medical concierge services. The differentiation of the brands allows for the development of different levels of services, from basic support to premium care. Thus, an agreement can create multiple commercial flows and demonstrate the adaptability of the model. Carnival Corporation brings together multiple brands that approach Greek and Mediterranean destinations, such as Costa Cruises, Princess Cruises, Aida Cruises, and P&O Cruises. A group-wide agreement can create a common framework of health support for different ships and different audiences. The collaboration can include annual destination sponsorship, a common shoreside medical response protocol, passenger and crew coverage, and a destination social program. The business value is standardization, a common model of care applicable to multiple brands and ports. Celestial has a strong Greek identity, a continuous presence in Greek destinations, and a deep knowledge of the Greek port reality. This makes it an ideal candidate for the role of founding Greek cruise partner of MediPort Katakolo. The collaboration may include official integration of MediPort into the destination experience, telemedicine services, transportation support, and actions for the local community. The particular value lies in the possibility of creating a Greek case study with the prospect of nationwide implementation. From Katakolo to a Greek model of health safety for cruising. Premium and luxury operators often target older and more demanding passengers, for whom reliable medical support at the destination is particularly important. For companies such as Viking, Oceania, Regent Seven Seas, Silversea, Azamara, and Star Clippers, MediPort can offer a premium care layer. This can include medical concierge, English-speaking telemedicine, VIP ambulance, and specialist support for elderly passengers. Here, health insurance does not only act as protection, it acts as an element of the premium travel experience and as a differentiation of the cruise product itself. MediPort's development follows a hierarchical and disciplined commercial strategy. First priority is TUI and Marella for impact financing and strategic partnership. Next is MSC for operational and equipment financing, Royal Caribbean for a health innovation pilot, and Norwegian for a group-wide agreement.
Carnival, Celestial, and Premium operators are then targeted through tailored proposals. Each approach has a different request and different value for the potential partner. This shows that the strategy is not based on a general search for sponsors, but on targeted agreements with a clear commercial logic.
The proposed first step is a pilot collaboration lasting a full tourist season. The pilot includes the operation of the MedSpot on arrival days, a predefined communication protocol, telemedicine support, direct access to an ambulance, and interconnection with hospitals. At the same time, it is planned to update ship and port operations, record aggregated data, interim assessments, and a final ESG and operational impact report. In this way, the partner is not required to commit to a large network from the outset. It first invests in a controlled, measurable pilot with clear success criteria and a specific expansion perspective. The success of the pilot will be captured by specific indicators from day one: arrivals covered, operational availability hours, number of incidents, and average first response time will be measured. Telemedical assessments, safe returns to the ship, transfers, as well as unnecessary transfers avoided will be recorded. At the same time, crew members supported, residents benefited, user satisfaction, and social value created will be evaluated. This is crucial for the investability of the model. We collect data, evaluate results, and document the value. Catacalo is not the end point. It is the first proof point. After the pilot is validated, the model can be applied to other cruise ports, island destinations, tourist marinas, high-traffic areas, and places with limited access to health services. The vision is an interconnected network of med spots, telemedicine, and ambulances with common protocols and central coordination. Here lies the greatest investment opportunity: the transition from a local facility to a replicable national infrastructure. One partner, one protocol, multiple destinations. The specific request is the participation of a strategic partner in the establishment and development of MediPort Catacalo. Participation can be structured as annual operating funding, purchase of a health service package, equipment financing, or coverage of services for passengers and crew. It can also include a social program, impact loan, co-branding, naming rights, or expansion planning to other destinations. The partner is not placed on the sidelines of the project. He is placed at the core of its creation. The opportunity is to acquire a strategic position from the beginning in a new health safety model for cruise destinations. MediPort Catacalo is not just a medical point. It is a safety infrastructure for passengers and crews. It is an operational service for the cruise. It is a social project for the local community. It is an investment in the resilience and competitiveness of the destination. And most importantly, it is a model that can start from Catacalo and expand throughout Greece. Today, we have the opportunity to create together the first comprehensive destination health and safety partnership at the gateway to ancient Olympia. MediPort Catacalo, where cruise safety meets community health.